Welcome to our fifth part of the cardiovascular physiology revision, which is based on MCQ. Heart valves, we know that the heart has four valves. So we have between the atrium and ventricle, we have on the left side, we have the mitral valve. And between right atrium and right ventricle, we have the tricuspid valve. These two valves, we call them atrioventricular valves, and atrioventricular valves should be closed during cardiac systole. So when the heart is ejecting the blood into blood vessels, these valves have to be closed, because if they are not closed, the blood will flow back from ventricle into atrium during contraction. So they have to be closed during systole. So if they are not closing during cardiac systole, so there will be regurgitation of blood. So we call that valve incompetence. Valve incompetence. Valve means the valve is not closing properly, and that causes the blood to flow back from ventricle to atrium during systole. So mitral regurgitation and tricuspid regurgitation will be associated with systolic murmurs. If we look at the aortic valve between the aorta and left ventricle, and the pulmonary valve between the pulmonary artery and the right ventricle, they should be open during cardiac systole, so the blood will be ejected into the blood vessels. So if they are not opening, so we call that stenosis, so aortic stenosis or pulmonary stenosis, that will be associated with systolic murmur, because they are supposed to open during systole, but they are not opening. So that will result in a systolic murmur. If they are not closing, they should actually close during cardiac diastole, so the blood doesn't flow back from the vessel to the ventricle. So they have to be closed during cardiac diastole. So if they are not closing, we call that incompetence or regurgitation, and that will result in a diastolic murmur. So I hope by this you could get an idea about reasons or causes, valvular lesions which causes systolic murmur. So valvular lesions which causes systolic murmur will be aortic stenosis, pulmonary stenosis, or if we are looking at the AV valves, it will be regurgitation, like mitral regurgitation or tricuspid valve regurgitation. If we are talking about diastolic murmurs, so that what causes diastolic murmurs, so it will be either the AV valves, which should open during diastole, they are not opening completely, so they are stenotic. So mitral stenosis, tricuspid stenosis will be associated with diastolic murmur, because they are supposed to open, but they are not opening completely. And also semilunar valves, when they are not closing completely, incompetence. So aortic regurgitation, pulmonary regurgitation will result in diastolic murmurs. This picture shows two types of blood flow, the laminar flow and the turbulent flow. So normally the blood flow inside the blood vessel is smoothly, we call that laminar flow. Inside our heart also the blood flow is laminar. If the blood flow get turbulent, so that causes a sound. So laminar flow doesn't produce any sound, but once the blood flow gets turbulent like that, that will result in a sound. When we place the stethoscope on the heart and we hear that noise, that noisy, because of the turbulent flow, we call that murmur. And if we are placing the stethoscope on the blood vessel and we are hearing the noise because of the turbulent flow, this sound on the blood vessel, we call it burwee. So that is the difference between the murmur and the burwee. Murmur is heard on the heart, burwee is heard on the blood vessels. And both of them are caused by turbulence in the blood flow. The turbulence can be because of many reasons. One of them is like what we see here is like the vessel gets like partially blocked, so the flow gets turbulent. It could be aneurysm, for example, as an opposite to that. When we talk about the heart, it can be because of the stenosis or incompetence of the heart valves, which causes the turbulence in the flow. When we hear abnormal sound on the heart, not 100% will be pathological, so it can be actually physiological, but most of the time is pathological. And the most common reason for heart murmur is valvular lesion, and the most common reason for valvular lesion is the rheumatic fever. The reference to the picture, which shows an abnormal mitral valve function, which murmur is most likely to be associated with the abnormality observed in the mitral valve. So we have here the mitral valve, and we can see why the heart is in systole, ventricle is contracting, so the blood comes back into the left atrium, and this is abnormal. So the abnormality here is mitral valve incompetence or mitral valve regurgitation. So the murmurs that will causes turbulence, of course, in the flow because of that backflow of the blood into the left atrium. And that turbulence happens during systole. That's why it's systolic murmur. So let's look at the options here. So we can exclude all diastolic murmurs. So we will be left with the option B, which is the pan-systolic murmurs. This is the correct option. Pan-systolic murmur, it means hollow systolic, means during the whole time of systole, there will be noisy hears, and that is because during the whole systole, there will be regurgitation of blood from left ventricle into the left atrium because of that regurgitation. So this is a mitral valve regurgitation causing hollow systolic or pan-systolic. 14-year-old boy presents with fatigue and shortness of breath. Fatigue, shortness of breath on exertion. On examination, his blood pressure is 140/50. 140 is the systolic, 50 is diastolic. So the pulse pressure here is 90 millimeter mercury. Is quite huge pulse pressure. The difference between systole and diastole is big. An early diastolic murmur is here on the left sternal border. Which of the following valvular diseases this patient is most likely to have? So here, the shortness of breath, the fatigue tells us that the problem is mostly on the left side of the heart. So involving the left side means it's either mitral or aortic. So it's an early diastolic murmur. So diastolic murmur can be because of either mitral valve is not opening, so we call that mitral stenosis, or aortic valve regurgitation. So which one of them? Is it mitral stenosis, aortic valve regurgitation? If we look at the systolic reading here, we see systolic pressure is high, and systolic pressure high, that already excludes that it's mitral stenosis. Cannot be mitral stenosis, because in mitral stenosis means the left ventricle is not filling with the blood. So this means the blood that is ejected out will be less, and that was going to decrease systolic, not increase systolic pressure. So we exclude mitral stenosis, and the big pulse pressures that we see here, it's actually characteristic for aortic valve regurgitation. Once we see high pulse pressure, high systolic, low diastolic pressure, that already indicates that the aortic valve has incompetence. There is aortic valve incompetence. The aortic valve does not close during diastole, and that is causing the blood to flow back from aorta into left ventricle during diastole, and that causes the pressure here in the aorta to be low during diastole. That's why diastolic pressure is low. So this means the blood will flow back into left ventricle during diastole. So with a subsequent ventricular contraction, the preload is high, and that results in an increase in the systolic pressure. So there is an increase in systolic pressure and a decrease in diastolic pressure, causing high pulse pressure, which is characteristic for aortic regurgitation. And because the regurgitation, the backflow of blood is happening during diastole, so the murmur is heard also during diastole. So the condition here is aortic regurgitation. 65-year-old man presents with worsening shortness of breath during exertion, and while he is lying down, again means the situation here, the problem here is mostly on the left side of the heart. Over the past 5 months, his temperature is normal, pulse is normal, respiration is normal, blood pressure is 155 systolic, over 50 diastolic. Again, we see here high systolic, low diastolic, high pulse pressure, the difference, and that is characteristic for aortic regurgitation. So a murmur that is here is a decrescendo, means the intensity of the murmur decreased, is on a decreasing pattern. So we call it decrescendo murmur. Immediately is heard after S2. It also indicates that the murmur is diastolic murmur. Along the left sternal border, why the aortic regurgitation murmur is heard on the left sternal border? Because of the direction of the backflow of the blood. We have the left ventricle, we have the aorta. So here's the blood flow back in that direction. So it's flowing back towards the left. So the turbulence is towards the left. That's why we hear the murmur on the left sternal border. So which is the most likely diagnosis? It will be aortic regurgitation again. So once we see this big pulse pressure, so it's aortic regurgitation. And aortic regurgitation murmur is a diastolic murmur, and it's a decrescendo murmur, and it's heard on the left sternal border. A 47-year-old woman with a history of a childhood heart problem treated with antibiotics, means during her childhood period, she had a heart problem and she was treated with antibiotics. She is currently presenting with a month-long history of shortness of breath while lying down, episode of bloody coughing, again, that all indicates a shortness of breath, difficulty in breathing, especially while the patient is lying down, and here's a cough, got blood, and that all indicates that this is a left side heart problem. She has crackles in both lungs, means there is some back pressure on the lung actually, and causes like some sort of congestion there in the lung, and a diastolic murmur at the left fifth intercostal space. So left fifth intercostal space, this is the apex of the heart, and this place is the best place to hear mitral valve associated problems. So if there is mitral valve stenosis or mitral valve regurgitation, the best place to hear the murmur for these lesions is the left fifth intercostal space. So you hear here diastolic murmur, left fifth intercostal space, it gives you that indication it's mitral, and it's diastolic, so it's mitral stenosis, because mitral valve needs to be opened during diastole, and if it doesn't open completely, that is going to cause a diastolic murmur. With an ECG shows tachycardia, no P waves, that because of the atrium there is a left atrial enlargement and the increase in the left atrial pressures that causes ECG changes. What is the most likely diagnosis here? So it is mitral stenosis. Aortic stenosis is wrong because it causes systolic murmur. Mitral regurgitation causes systolic murmur. Aortic regurgitation causing diastolic murmur. But this diastolic murmur, it should be associated with the high pulse pressure. And it is yearly diastolic murmur. And it's heard on the left sternal border. So that excludes aortic regurgitation. A 75-year-old man with a month of progressive shortness of breath, fatigue, hypertension, hyperlipidemia, and a long smoking history presents with dizziness, and he has a blood pressure of 100/80. So if we look at the blood pressure here, systolic is quite is low. It's on the low side, so we have a low systolic pressure. Diastolic is normal. So it should be a problem here with the systolic pressure. His peripheral pulse, weak. So that all tells you, okay, there should be a problem in aortic valve. And mostly it will be aortic valve stenosis because of the decrease in systolic pressure. Means the valve is not opening for the blood to be ejected out. So the pressure will be low during systole. So systolic murmur. Systolic murmur is also heard here, and this murmur is radiating towards the neck. That is because, again, here there is difficulty in the aortic valve to open, so the blood, while it flow out from the left ventricle into the aorta, it causes turbulence, and you hear the murmur. And because systolic pressure is low, the peripheral pulses are weak. Which is what is most likely to be found on further evaluation of this patient? White splitting of S2. S2, second sound, is caused by the closure of aortic and pulmonary valve. And splitting normally is physiological splitting can be seen during inhalation because aortic valve close a bit earlier than pulmonary valve. But white splitting can happen in conditions like, for example, like more delay of closure of pulmonary because of pulmonary stenosis, for example. So that can cause a white splitting of the S2. But in conditions of aortic stenosis causes delay in the closure of aortic valve. Delay in the closure of aortic valve will make it closer to pulmonary valve closure. So white splitting is actually wrong option. Waterhammer pulse is a white pulse pressure. We already can exclude that because we can see here the pulse pressure is very narrow. Okay, it's 20 millimeter mercury, is quite low pulse pressure. Left ventricular hypertrophy, that is very correct, very true, because when we have stenosis in the aortic valve, means the aortic valve is not opening, so this means the blood is not coming out, so it will be kept here in the left ventricle. So the left ventricle, because of the high load on it, that will cause this ventricle to hypertrophy, and that is left ventricular hypertrophy. Left ventricular hypertrophy is a compensatory mechanism which happens in response to aortic valve stenosis because of the high afterload on the left ventricle.